Now with a report on the flu vaccine, here's Laura Windsor.
The Centers for Disease Control and Prevention recommends an annual flu vaccine for everyone 6 months of age and older. But is the flu vaccine safe for a pregnant woman? We went to Pomona Valley Hospital Medical Center and asked Dr. Hellen Rodriguez that question.
The flu is an illness that is caused by virus. There are different types of viruses that cause the flu. Most of the time, the flu will give you symptoms of general achiness and just feeling sick. Oftentimes, you get respiratory symptoms, so you can get cough, nasal congestion, and most people, a little bit of a fever, headache. Most people will have flu-like symptoms for 4 or 5 days, and then they will get better. Occasionally, it will affect their lungs, and it can turn into a pneumonia. And those are the patients that get very, very sick. The populations that are most likely to get very sick from the flu include our senior citizens, people that have some kind of chronic diseases, pregnant women, and children, particularly babies. When women are pregnant, they oftentimes think that doing things like vaccinations may possibly harm the baby. However, that is definitely a wrong idea, because on the contrary, doing the flu vaccine not only will protect her, but it also protects the baby after the baby is born. Women and newborn babies are a particularly vulnerable population to the influenza virus. So they get sicker, and there's a higher mortality when women get the flu during pregnancy. So it's very important that they protect themselves. Additionally, when the babies are born, they're more vulnerable. They're likely to get sicker if they're not protected. If the mom had taken the flu vaccine while she's pregnant, she will passively pass on some of her antibodies to the baby, so the baby is actually protected for the first few months. Babies cannot get the vaccine until they're about 6 months of age. So the fact that they have the protection from the mother while she was pregnant helps them to prevent the flu. One of our patients that came to Pomona Valley with the flu got extremely sick. As a matter of fact, she almost died, and we had to deliver her baby prematurely to try to save her. So it did harm to both her and the baby, the fact that she got the flu during the pregnancy. It could all have been prevented if she had gotten vaccinated. Fortunately, Martha did well and recovered, and her baby did spend several weeks in our neonatal intensive care unit, and the baby also did well. And so now Martha is a big supporter of getting immunized, or getting the word out that women should get immunized while they're pregnant. We're not only encouraging, but we're trying to supply the vaccination so that it is present at all of the offices and all of the clinics where the patients get care. Because by talking to some patients, we found out that even though the doctors were telling them that they should get the vaccine, it just wasn't convenient for them because they were not receiving it at the same place where they were being told to get it. So what we're going to do for this next flu season is make sure that the vaccine is available at the place where they're getting their prenatal care. So we're hoping to get a lot more patients vaccinated this year. Anybody that is going to be pregnant or be delivering during flu season, that is between September and May, should definitely get the flu vaccine. And now there are 2 different types of vaccines. The pregnant women, we recommend that they get the injection. There's also a spray, which that one we do not recommend for pregnancy, but definitely the injection. And as of now, there's no study that has ever documented that there's any harm, and there's plenty of evidence that it is very good, and that's prevent problems.
Antibodies that form in response to the flu shot will not only protect you from the flu, but it will protect your baby, especially if you breastfeed your newborn. For the American Health Journal, I'm Laura Windsor.